Hi, my name is Danielle Kitney and I'm a psychology assistant at the National Centre for Mental Health, or NCMH, based within Cardiff University. On behalf of the NCMH team, I will be narrating this presentation which looks at the development of the NCMH online cohort to investigate the causes and triggers of mental health problems in adults. The National Centre for Mental Health is a Welsh Government-funded research centre based at Cardiff, Swansea and Bangor universities, where we investigate the causes and triggers of neurodevelopmental and psychiatric disorders. Since NCMH was established in 2011, more than 20,000 participants have been recruited into the cohort and provided psychological, social and biological information in structured face-to-face interviews. In March 2017, NCMH launched an online survey for adults of 18 years and over to take part, enabling wider access to the study. We currently have 7,060 participants recruited into the NCMH online cohort to date. So this presentation will focus solely on the online cohort and will explore the diagnostic and demographic trends in the data collected from participants. I'll also discuss communication strategies for recruitment and the future direction of our online survey. The NCMH online study was developed by taking questions from the traditional face-to-face assessments which focus on demographic information, mental and physical health, family and lifestyle. To advertise the study, several approaches have been adopted to recruit participants into the online cohort. These include targeted Facebook adverts, email campaigns such as the campaign targeting Healthwise Wales participants, and distributing flyers at events that the team attends. To join the study, potential participants can access the study directly via the NCMH website or the links advertised on social media. When deciding to join, individuals are directed to a web page outlining the aims of the research, what taking part online entails, and information regarding confidentiality and withdrawal from the study. If after reviewing this information, potential participants wish to participate in the online survey, they follow a link to access the online survey platform and consent to take part in the study. Participants then complete the online assessment. The information obtained will be stored in a secured database and used for data analysis, and participants who have consented to future contact will also be contacted for further research online. As I previously mentioned, 7,060 participants have taken part in the online survey to date. As you can see in Figure 1, the results show that of the 7,060 participants who took part in the study, a significant number of those identified as female, with 79% of participants, whereas only 19% of participants identified as male and 2% of participants identified as trans, gender variant or non-conforming. Figure 2 also shows that a large proportion of participants also identified as white, with 93% of participants identifying as white, Welsh, English or British, meaning only 7% of participants identified as Asian, Black or mixed ethnicity. Looking at Figure 3, the most prevalent age group was those aged 18 to 29, with 33% of participants being within this age group. There's a fairly equal proportion of participants between the ages 30 to 69, with around 15% of participants being within each of these age groups. We then see a decrease in participants aged 70 and over, with less than 1% of participants being within the 70 to 80 and over 80 age groups. Of the 7,060 participants, 71% of those who took part in the online survey had been diagnosed with or received treatment for one or more mental health conditions. As we can see within Figure 4, a significant number of participants reported having a diagnosis of depression or anxiety, with 56% of participants reporting a depression diagnosis and 46% of participants reporting an anxiety diagnosis. Within this chart, I've also included some of the diagnoses that are of particular interest to some of the researchers within NCMH. This is what we call our core diagnoses. As you can see, the number of participants reporting these diagnoses are much less than those reporting depression and anxiety, with only 10% of participants reporting a PTSD diagnosis, 7% reporting a bipolar disorder diagnosis, less than 1% reporting schizophrenia or a schizoaffective disorder, and 3% reporting a psychosis diagnosis. The demographic information suggests that some groups were more likely to take part in the NCMH online survey compared to others. There is an evident gender difference in the sample, with considerably more females taking part compared to males. There's also considerably more individuals of white ethnicity that have taken part in the study compared to Asian, Black, or mixed ethnicities. It also appears that those aged between 18 to 29 years old were more likely to take part in the research compared to any other age groups. These gender, age, and ethnic differences in the cohort could be due to several factors, such as our recruitment methods and where the study is currently being advertised, as well as having access to the internet. An advantage of recruiting participants via the online survey is that a large cross-diagnostic sample has been collected in a resource-efficient way. Recruiting online also enables NCMH to recruit over a wide geographical area. However, it is unlikely that the current online cohort is representative of the general UK population, but this information will inform the development of new strategies to target these less represented groups. Overall, it does appear that NCMH's online recruitment methods have been effective to date in generating interest in the study, with advertising techniques resulting in over 7,000 participants having been recruited into the online cohort since March 2017. So what are the future aims for NCMH's online surveys? As I imagine many researchers are, the NCMH team are researching the impact of the COVID-19 pandemic. Our team have developed online COVID-19 surveys which aim to explore the impact of COVID-19 on individuals with pre-existing mental health conditions. Alongside our COVID-19 research, NCMH aims to create a large cohort of participants to recontact regularly to collect additional diagnostic-specific information. The NCMH online study seeks to develop population and diagnostic-specific online surveys, focusing on specific groups such as our student surveys, as well as bespoke online surveys for diagnoses of interest to the NCMH team, such as our trauma or perinatal-specific surveys. By expanding our bespoke surveys, we hope to address our shortfalls and provide more in-depth data by including more questions of diagnostic relevance. We also hope to advertise via NHS channels to recruit from our harder to reach populations, such as those with schizophrenia or schizoaffective disorder. On behalf of the NCMH team, I would like to thank you all for taking the time to listen to our presentation, and if you have any questions, please feel free to contact us via the details on the slide.